reproductive physiology, oogenesis, as well as ovulation and menstruation. All right, so first and foremost for oogenesis, this is just production of our eggs. All right, so how do we produce our eggs? And they really want you to know kind of two main facts. The first fact is that at birth, all females are born with a set amount of eggs, okay? So that means, once again, comparing it to the male reproductive system, they have a limited amount of time for fertility, okay? And so at birth, they're born with a set amount of eggs, all right? And they're all stuck, okay, in meiosis 1, arrested in prophase 1, okay? Then at puberty, okay, once puberty hits, they move from prophase 1 into metaphase 2, all right? At puberty, they move from prophase 1 to metaphase 2, and then as fertilization occurs, they finish the process, okay? But if fertilization does not occur, then the process does not end, okay? It does not become done, all right? So what they want you to know is that you're arrested in prophase 1 until ovulation, right? And then you're arrested in metaphase 2 until fertilization. Does that make sense? So the whole entire time you're in prophase 1 until you start to ovulate. Right when you ovulate at puberty, you're going to change from prophase 1 to metaphase 2. All right? Metaphase 2 is going to be arrested in metaphase 2 until fertilization, until the sperm actually fertilizes the egg. All right? I hope that was clear. I'm going to say it one more time because this can be confusing. So, once again, during fetal life, right, when you're a fetus, you have all of your eggs already, right? Now, it's arrested in prophase 1. So before puberty, you're arrested in prophase 1. All the eggs are arrested in prophase 1. Okay, right when puberty hits, then every egg that's ovulated will no longer be in prophase 1. It will go to metaphase 2. Okay? And that egg, all right, if it's fertilized, then it will complete the process. It will move on from metaphase 2 and complete the process. If it doesn't get fertilized, it stays into metaphase 2 and it's kind of discarded essentially. All right? Now, how does ovulation occur? How does this whole process occur? Well, once again, we're going to talk about the follicle. So we have follicular rupture, okay, rupture. So the follicles are going to rupture, all right? And that's secondary to the fact that we have a sudden LH surge at the mid-cycle, all right? And so this whole entire process of ovulation is secondary to the fact that we have such high levels of LH. Now the question is, what causes this LH surge? So let's start from day 1, all right? So the first day after your menses, you're done with your menses, we're starting with day 1. We have estrogen levels rising, all right? And as estrogen levels rise, we have a proliferation of cells at the endometrial lining. All right, so our endometrium starts to thicken up, because that's what the estrogen does. It causes endometrial hyperplasia, all right? So estrogen levels rise within the first couple of days, all right? And that leads to an overall decrease in FSH and LH, right? Because estrogen is going to be a negative feedback inhibitor of FSH and LH at the anterior pituitary. So increased levels of estrogen means decreased levels of FSH and LH. But as time goes on and estrogen continues to increase, we have increased production of follicles, and we start to grow one main follicle at the ovary. We still are producing more cells at the endometrial lining, and we're thickening up the endometrium. But as estrogen levels begin to increase at such high levels, we see a reversal in the negative feedback mechanism. For some reason or another, we're not sure why, the high levels of estrogen, such high levels of estrogen, lead to an actual such high levels of LH. And this is known as the LH spike. And the LH spike marks ovulation, right? When we have a spike in LH, it leads to ovulation and the rupture of the follicle, producing an egg. Right when that egg is produced, we have the corpus luteum produced as well. And the corpus luteum is going to now increase levels of progesterone, as we know. So we've stopped now endometrial hyperplasia and production of cells, and we've now started to kind of thicken up the endometrium. All right, so we're adding nutrients, we're adding more coiled blood vessels, okay? And we see an overall drop in LH and FSH in this time period because progesterone is now the new marker, all right? So the first phase before ovulation is known as the follicular phase, and the last phase after ovulation is known as the luteal phase, okay? So keep everything that I just said in mind. That's just the whole entire process in which ovulation can occur, all right? So that LH surge is very, very important. Now, there is a pathology associated with ovulation, all right? So if you have pain with ovulation, it's called Mittelschmerz, all right? Mittelschmerz is associated with any type of pain during ovulation. The question you might be saying is, how would I ever be able to differentiate that from different pathologies that have patients with pain, all right, in that region, okay, upon any type of menses, right? Because it's very common. The key to the vignette is going to be what week is the pain occurring. If the pain is occurring 2 weeks after your menses, then the answer is going to be Mittelschmerz, all right? And the reason behind that is because essentially 14 days or 2 weeks after menses, you have ovulation occurring, all right? And so that's how we're able to tell. Look at the vignette. They will say exactly 2 weeks. They will say 2 weeks or 13 days or 14 days, right? They will say that. And then they say that's the pain. They had their menses 2 weeks ago. Then you know it's Mittelschmerz because you know that that's when ovulation is occurring. Very important. They love to ask about it, all right? So now since we talked about that 14-day period, let's talk about essentially the regular cyclic changes of the menstrual cycle, all right? So first, we have 2 cycles. We have the ovarian cycle and the uterine cycle. And they always start, okay, the first day of menses to ovulation. And this is known for the ovarian cycle as the follicular phase. The reason it's called the follicular phase is because we're going to start to develop more follicles, all right? So we have follicular development, and essentially this phase can fluctuate, all right? It doesn't have to be a set 14 days, and they love to ask about this because from ovulation to your first menses, all right, this is the luteal phase, and that is a set 14 days, all right? Very, very high yield, very important to know this. So the follicular phase is just when we're producing our follicles. It's before ovulation occurs. We're getting kind of ready to choose an egg to be ovulated, all right? This can last different periods of time. It usually is 14 days because the whole entire cycle is roughly around 28 days for each female, but it can change. So it usually could be 14 days, but it doesn't have to be. But then after ovulation, from ovulation to when you have your first day of menses, it's very important that that is exactly 14 days. No changes should occur. If there is a change, it's pathological, all right? The luteal phase must be 14 days long. It's fixed 14 days long from ovulation to your first menses, all right? And the reason they call it luteal phase is obvious because the corpus luteum is going to be formed, all right? Now, what's happening in the uterine cycle? Well, during the follicular phase, all right, of the ovarian cycle, let's see what's going on within the uterus. We're going to have the proliferative phase, right? Because the estrogen's going crazy, so we're going to have endometrial development because of estrogen. But then the next 14 days during the luteal phase, all right, this is known as the secretory phase. This is going to be mainly done by progesterone. So we have endometrial preparation for implantation, all right? Lastly, when menses occurs, they want you to know the process by which it occurs. It's due secondary to cellular apoptosis, all right? And that's an important aspect of it all. That's all for the menstrual cycle, as well as our oogenesis and ovulation. If you have any questions, please reach out. I know this whole process can be confusing, but just stick to the facts. Follow the cycle, and you will be good, all right? That's all.